children's hospitals continue to feel the strain of too many young patients and not enough beds. Tonight, there has been a surge of children being airlifted out of town for care. In one case, a 4-year-old and his mother had to go 350 kilometers away from family support.
It's every parent's worst nightmare, really. You hear in the news that there's this medical crisis going on right now, but you never really think that it's going to impact you.
Stephanie Rutherford's 4.5-year-old son, Remy, became critically ill with a bacterial infection. The closest pediatric ICU bed that was available was in Kingston, 350 kilometers from his home in Simcoe.
We're grateful because the care has been amazing, but it shouldn't have come to this.
The reality is the number of children that have had to be airlifted to other hospitals hit a new high last month. Look at the top gray line on this graph from Orange, Ontario's air ambulance service. It shows close to 140 young patients with respiratory illnesses had to be transported to other hospitals. That's about a 150% increase from the 2 previous years in November. When asked about children being transferred away from home, this was the Ontario Health Minister's response.
I get it. It's not ideal as a family to have a child that far away. It's frankly an example of how our hospitals are working together.
Children's hospitals have been under tremendous strain for weeks due to a surge in respiratory illnesses. The red line in this chart from CHEO, Ottawa's Children's Hospital, shows the spike in flu cases since September compared to previous years. Ontario traditionally only has 112 pediatric intensive care beds across the province. This year, the cracks in the system are being exposed like never before.
The reality is that the number of pediatric ICU beds in the province has probably been insufficient for several decades.
Bottom line for parents watching this, if their child gets sick, will they get proper care in time in this province?
Yeah, I think that we're certainly more challenged than we've ever been. And that will sometimes require longer periods for a child to receive the care that you would like them to.
Bruce Squires is the president of McMaster Children's Hospital. He says it's believed cases could continue to remain high through to January and February. Premier Doug Ford today acknowledged the strain on ICUs. His advice?
Go out and get your flu shot.
Now, Stephanie says her son is supposed to be transferred to the hospital for sick children on Friday and will need rehab after that, so could be transferred again. The NDP today called for the Premier to recall the legislature to deal with what they call the health crisis.